Dr. Adjei, what are the largest barriers you're facing when it comes to improving cancer treatments and care?
Well, there are several, but number one, obviously, is financial, right? And so you heard about a lot of the wonderful treatments that we have now. Dr. Abdullah alluded to some, right? And there are others. So, for instance, a patient with melanoma can get their tumor removed, and we treat it in the lab to generate immune cells that then gets infused back into the patient to be able to now attack the tumor, right? So tumor infiltrating lymphocytes, we call it, So the earlier ones we tested, the patients tested in are patients with melanoma. They've done all their treatments and now nothing works, they have no hope. And you have this TIL therapy, works great. You know the cost? About $520,000, right? And I can go on and on. You've heard about CAR T therapies, and typically the cheapest one will be about $400,000, right? So we are making these innovative findings, and we have these exciting drugs that can actually be like miracles, but they're very expensive, right? And so you think about the patient with a 20% copay. And now the drug is $500,000. So do the math, right? So affordability is a big problem that we face. And then access. Cheryl spoke about that, right? We have a lot of clinical trials at Cleveland Clinic. And a lot of times our patients don't want to participate because they can't go back and child care, transportation, and if they get the local treatment in the oncologist next to them, they can go in, get their treatment and go to work. Whereas with the clinical trial, they can't, right? So what we are doing, we are fortunate in Northeast Ohio, we have about 16 sites. So we are moving our clinical trials. We have a hub and spoke model so that everybody can go to the closest place to where they live so that they can get their treatment and go. So that's something we are working on. The challenge, when we do some of these digital, one lesson we learned, we can do e-consent, so you stay at home and virtual visit and you sign your consent. Well, a lot of our patients don't have internet. Or they can't make it work, right? So it was proving very difficult. So we've had to have these hub and spoke systems so that if you don't have internet in your home, you can go to the closest Cleveland Clinic location and sit by a computer and do your consents and everything. And you might come to main campus only once, and then you go back and do your treatment.